Alright, so this is going to be the beginning for ATI mental health nursing. So, chapter 1, basic mental health nursing concepts. So, starting with assessment, psychosocial history, you can ask them their perception of their own health, beliefs about illness and wellness, their activity, leisure activities, how the client passes the time, any substance use or use disorder, their stress level and their coping abilities, their usual coping strategies, support systems. You ask their cultural beliefs and practice, because it can impact their care. The nurse's awareness alleviates stereotyping, use an interpreter when needed. Spiritual and religious beliefs. Spirituality refers to the client's internal values, sense of morality, and how he or she views the purpose of life. So it's separate from religion. And religion refers to the beliefs according to an organized set of patterns of worship or rituals. You can assist the client to identify, support people and resources. You can do a mental status exam, and that has 3 components: level of consciousness, physical appearance, and behavior. So level of consciousness, it has more than 3. It also has cognitive and intellectual abilities. So level of consciousness, alert, which means they're responsive, available to fully respond by opening their eyes, normal tone of voice and speech, answers questions spontaneously and appropriately, lethargic, that's just be able to open your eyes and respond but still drowsy, falling asleep readily. Stuporous, that's when the client requires vigorous or painful stimuli, pinching a tendon or rubbing the sternum to elicit a brief response. She might not be able to respond verbally. Comatose, the client is unconscious and does not respond to painful stimuli. Some abnormal posturing in a comatose patient. Decorticate rigidity, which is flexion and internal rotation of the upper extremities, joints, and legs. So it would be like this. And then we have decerebrate rigidity, neck and elbow extension, wrist and finger flexion. Okay. Physical appearance is the next level of the mental status exam. Personal hygiene, clothing choice, if they're clean, kempt, dressed appropriately. Next is their behavior, their mood, which is like happy, smiley, whatever. And their affect is an objective expression of mood. So mood, you can ask them how you're feeling today. If they say great, bad, whatever. And then their affect is the objective expression, so it's what we see. They can have a flat affect or a lack of facial expression, or they can look happy, sad, grumpy, whatever. So next is their cognitive and intellectual abilities. So you can assess if they're oriented to time, person, and place. Assess their memory, both recent and remote. You can ask immediate memory, so ask a client to just repeat a list of things you say. Recent, you can ask them to recall events such as visitors from the current day, or the purpose about this health mission or assessment. And then remote, you can ask them a fact that is verifiable, such as their birthday or their mother's maiden name. Assess their level of knowledge, so you can ask them what they know about their current illness or hospitalization. You can assess their ability to calculate, for example, have them count backwards from 100 by 7, so they have to calculate in their head. Asking the client to see if they can think abstractly. For example, see if he can interpret a cliche such as, killing 2 birds with 1 stone. Perform an objective assessment of the perception of their illness. Assess the client's judgment based on a hypothetical question. So, for example, what would you do if there was a fire in your room? That's their judgment. And then you can assess their client's rate and volume of speech, as well as the quality of language. His speech should be articulate, responses meaningful, and appropriate. All right, some other standardized screening tools. We have the MMSE, which is the mini mental status exam. Mini mental state exam. That is just objectively assessing the client's cognitive status by evaluating orientation to time and place, their attention span and ability to calculate backwards by 7, registration and recalling of objects, and then language, including naming objects, following commands, and ability to write. Then we have the Glasgow Coma Scale. So this exam is just a baseline assessment of the client's level of consciousness. It's just eyes, if they're open, closed, whatever, verbal, if they can respond, motor response, evaluated, and then a score of less than 7 indicates that they are in a coma. So, some considerations for children when you assess them. Mentally healthy children usually trust others. They view the world as safe. They accurately interpret their environments. They master developmental skills, use appropriate coping skills. Children and adolescents experience some of the same mental health problems as adults. Mental health and developmental disorders are not always easily diagnosed, preventing treatment right away. So, because usually the kids may not know what's happening, or there's a wide variation of normal developmental stages. You want to assess their mood, assess for any anxiety, developmental, behavioral, or eating disorders, any risk for self-injury or suicide. You can use a standardized tool. It's called HEADS, HEADSS, which is home environment, education or employment, activities, drug and substance abuse or use, suicide and depression, savagery. So home environment, what's the home like, what's the family like, who do they live with, what the relationships are. Education and employment, how's their schooling going, do they have a job. Activities, do they participate in sports, how do they interact with peers. Any drug or substance use, if they use alcohol, tobacco, marijuana. Suicide, depression, if they're any risk for any suicide or self-injury, if they're having indications of depression. And then savagery is the client exposed to abuse in the home or violence in the neighborhood. Alright, so now to older adults, you can assess their functional ability, economic, social status, environmental factors, such as if they have stairways in the home that can affect their lifestyle. There's some different standardized assessment tools. They have the Geriatric Depression Scale, short form, the Michigan Alcoholism Screening Test, geriatric version, the MMSE, which is the Mini Mental State Exam, pain assessments, FACES Pain Scale, revised, pain questionnaire, and pain assessment and advanced dementia scale. Conduct an assessment of all clients, including older adults, in the following manner: quiet, private space, adequate lighting, accommodate for any impaired vision or hearing, introduce yourself, stand or sit at their level, touch as appropriate. However, if they don't want to be touched, respect that space. Include any questions relating to difficulties sleeping, incontinence, falls, injuries, depression, dizziness, loss of energy. Include the family or significant others as appropriate. Obtain a detailed medication history. And following the interview, summarize and ask for any feedback. So, diagnosing, we're going to use the DSM-5, which is a Diagnostic and Statistical Manual of Mental Disorders, 5th edition. It's published by the American Psychiatric Association, uses a diagnostic tool. Nurses use it to identify diagnosis and diagnostic criteria to guide assessment, identify nursing diagnosis, and to plan, implement, and evaluate care. Serious mental illness includes disorders classified as severe and persistent mental illnesses. Clients have often difficulty with ADLs and can be chronic or recurrent. There are some role or life changes. So some role changes are predicted, such as an upcoming retirement, but some things may be unexpected, such as being a recipient of care due to sudden illness or injury. Some other role transitions include loss of employment, divorce, retirement, grandparenthood, widowhood, death of a parent, new caregiver, or recipient of care. You always want to assess the client's ability to adapt and cope. Evaluate whether the client has successfully adapted. Are they able to state coping behaviors, identify maladaptive coping behaviors, participate in community resources, have a list of stress reduction techniques, maintain housing and employment? You can assess their ability to adapt by their health status, functional ability, living arrangements, personality, client, caregiver, and family assessment, level of information they have, medication or supplement use. So some therapeutic strategies in the mental health setting: counseling, which is just therapeutic skills, assist with problem solving, crisis intervention, stress management. Milieu therapy, which is orienting the client to a physical setting, identifying rules and boundaries of the setting, ensuring the safe environment for the client. It's a controlled setting. Promotion of self-care activities, allowing time for them to complete. Setting incentives to promote self-care. You don't want them to become independent. You don't want them to become dependent. Psychobiological interventions, so that would be administering medication and teaching about the medications, monitoring for adverse effects and effectiveness of the therapy. Cognitive and behavioral therapies, that's more modeling, operant conditioning, systematic desensitization. Health teaching, which is teaching social and coping skills. We have health promotion and health maintenance, which is assisting the client with cessation of smoking, monitoring other health conditions. And then we also have case management, which is coordinating holistic care to include medical, mental, and social services. All right. So then when we go to the questions, I think everything was understood. So that was chapter 1, ATI, mental health.